Hey guys, it's Dr. Nate here, and thank you for watching this. This is going to be a very important video because this is mainly meant for our assistants. Maybe some other people are going to watch it too, but it's mainly meant for our assistants. And what I'm going to talk to you about today is the basics of orthodontic assisting. So most of you guys and gals probably have some experience with the general dental side, and now we're going to kind of move you to the ortho side with me or with one of the other orthodontists. So I want you guys to know the basics, so the basic terminology, what different brackets are, different kind of stuff I want you to know, and that's what these videos are going to be about. So by the end of these, probably it's going to be a couple videos, you are going to know the differences between the different brackets, different wires, how we do consults, how we do banding, bonding, what's a band, how the different materials, all the different tools. You will have the basic knowledge of all that, so then we can kind of keep amplifying that knowledge as we go through the days. But today is going to be the basic intro, so let's get it. Alright guys, so step number one, what is an orthodontist? And I need you to know this so that you can help tell the patients and tell whoever is wondering what is an orthodontist, because I swear I don't know if everybody knows this. So every orthodontist is a dentist, okay? But not every dentist is an orthodontist. So an orthodontist is a dentist who decided to do more schooling, in general 3 years on average, to do basically braces, Invisalign, anything that has to do with tooth movement. So that is what an orthodontist is. That's an orthodontic specialist. Somebody just asked me yesterday, is there a difference between an orthodontist who is board certified and an orthodontist who isn't board certified? And a little bit. A board certified orthodontist is just an orthodontist who decided to do or take an extra test and present these cases to these board members, and that's how we became board certified. So there's still an orthodontist. There wasn't any more schooling they went through. They just did this extra test and presented these cases, and now they become board certified. Okay, so let's start with the basics, and I want to talk to you about brackets and braces and all that fun stuff. So let's talk about the size differences. And we get this question pretty often. So they say, hey, can't you just transfer this case because your metal braces aren't all metal braces the same? And they're not the same. So in general, there's two different sizes in North America anyway. There's an 18 size and a 22 size. And what that basically means is that is the size of the slot area. That's the area that takes the wire. That's the size difference. So some are a little bit smaller, some are a little bit bigger. We use an 18 slot just because that's what we've been using since day one. That's why I like a little bit more. But no, there's nothing better with the 22 or nothing worse than a 22 slot. We just use an 18 slot here. Obviously there's metal braces, which you can kind of see here. We got clear braces, and then there's Invisalign. Those are the three kind of most common things that we use. Now let's go through tooth numbering, and this is different than pediatrics, and this is different than general dentist. We use a different system where we count from the middle. So everything is counting from the midline right here, okay? So centrals are called ones. So this is a one, and then this is a one. Laterals are called twos, canines threes, premolars fours, 5, 6, 7, all the way to the wisdom teeth that are the eights. And if you have more teeth, it'd be even more. But we count from the midline, and that's why it's a little bit different. We normally would say, hey, bond the upper right 3, and that would be the upper right canine. So 3 in general dental terms is different than a 3 in ortho terms. 3 in general dental terms would be the first molar. Yeah, it'd be first molar. But 3 for us is canines. So sometimes I hear me saying, okay, we're going to do a full mouth case, but we're going to extract all the 4s. That would mean, hey, we're extracting all the first premolars. So that is kind of something you need to know. You need to know the basics, and naming of the teeth or numbering of the teeth is important. So remember, everything's starting from the center, and we go out from there. So 1s, 2s, 3s, 4s. Same thing on the bottom. 1s, 2s, 3s, 4s, all the way to the back. So that's the numbering of teeth in orthodontics. Some more basics of orthodontics is the difference between a nite wire and the stainless steel wire. There's not necessarily a size difference, and that's a common misconception. You can have the same size dimension of a nite wire, which is a nickel titanium wire, versus a stainless steel wire. They can be the same size. Size is not the issue, it's not the difference. It's what it's made out of. So let me give you an example here. So this is a night tie wire. Super, if you'll be able to see this, super flexible. No matter what I do, I can bend it, I can shape it, I can make it into O's, and it always goes back to that same shape. This is a nickel titanium or night tie wire. So you will notice that in virtually 100% of the time, we will start with a night tie wire. And the reason for this is people's teeth are crooked, they're crowded, they're all over the place. You can't put a stainless steel wire in because it doesn't have that same give. So you almost always start with a night tie wire. This is a stainless steel wire. Very, very different. It starts same kind of shape, but if I bend it, boom, it stays like that. Okay, so that's the difference between the night tie wire and a stainless steel wire. So let me go through the sizes too. At our office, we have a 12, 14, 16, 16 by 16, and 16 by 22 size of wires. And that can be either night tie or it can be stainless steel. But in general, the only stainless steel wires that we really have here are the 16 by 22. And you're like, what the heck? What is that? What are those numbers? I don't understand. That doesn't make sense to me. And the wires sizes are basically the dimension of the wire. Okay, so let me go through this a little bit. If I were to take this wire, this is a stainless steel wire, and I did a cut right through, and I looked at it from the side, that would determine the size of the wire. So say I do a cut through this wire right here, and I look at the side dimension, this is actually a 16 by 22 wire. So if I did a cut, and I'll probably have a little infograph right here, the dimensions would be 22 by 16 or 16 by 22. If I was to do a cut through a 16 night tie wire, if I did a cut through that and looked at it from the side, the diameter would be 16, and it's actually not 16, it's 0.016 millimeters is the actual thing, but we just always call it a 16. So that's actually in millimeters. It's 0.016 millimeters. So that's the difference between a 16 night tie or a 16 wire versus a 1622. It's the thickness. So in general, when you go up in thickness, or if you go up in the dimensions of the wire, you go up in the thickness. That's why you can have a 16 by 22 night tie wire, which is basically the exact same dimension as a 16 by 22 stainless steel wire. But as you know, the stainless steel is quite a bit stronger than the night tie. So I need you to understand that, and hopefully the infographics will help a little bit. This is always a little bit harder for me to understand or to explain without having some models here. So I just got this question asked also a couple days ago, and they're like, hey, what's the difference between 16 night tie versus 1622? Like, I get it, it's kind of stronger, but what is it really doing? And normally the smaller wires, the 16 night ties, let's say, is used for straightening of the teeth. It doesn't work on the torques, the back and forth. Okay, so that's normally the 16 night ties or the 14 night ties or the 12 night ties. Those are working on the straightness of the teeth. Once you start getting into the 16 by 22 night tie wires or 16 by 22 stainless steel wires, that's working on the torque, and that is the back and forth. So the round wires in general are working on the straightness, and the other wires, the 16 by 22 or some version of that, are working on the torques, the back and forth of it. And once again, it's gonna be a little bit easier once I have those little infographics here, because you'll see the 16 by 22 night tie or stainless steel wires are gonna fill the bracket slot more. So when you have a 16 night tie, the smaller night ties, it basically just goes in the bracket, and it has lots of wiggle room. You know, it doesn't really kind of fit in the bracket that good. But when you get a 16 by 22 night tie, that's going to fit in the bracket slot really, really well, and that's how you get the torques of the teeth. All right, so let's talk about the difference between normal colors and power chains. So colors, or O-rings or elastic ties, that's these guys here. That's what we most of the time start off with. That is going to help put the wire into the bracket. So it kind of forces the wire into the bracket. These are power chains here. This is way different than this. This is used most of the time for closing spaces. And you can see this, right? So if you basically put this on the tooth, You kind of force it on there, it stretches, it always wants to come back to its normal form. So you put it on the tooth, you stretch it, and it basically wants to close up. That is a power chain. We don't normally start with this. It takes us quite a while to get to that point. So normally we start with these, but this is a power chain. That's the difference between an O-ring or elastomeric tie or colors versus a power chain. All right, as far as instruments go, you got the bracket holder, the straight cutter, mathau plier, distal end cutter, and then also an explorer. If we go to the banding instruments, you have a band plugger, band pusher, a debander. This is a bracket holder, and you can have the separating pliers. If you go to the burrs, pretty standard white stone, you have a donut burr, and that's an ortho debond burr. All right, guys, so now you know the instruments, the difference between banding instruments and bonding instruments. The one thing I want to go through is whenever you're cleaning these, it's slightly different than if you're going to clean general dental instruments. And the reason is I don't want them to corrode. So you're going to be using this. Obviously, it's going to come in different bottles depending on what office you're at. But this is an ortho milk solution. And when you're doing it, make sure when you're cleaning the instruments, obviously if there's any debris on them, you're just going to clean it off with water. But then you're going to take this milk solution and spray it on the spots or the surfaces that are inside the mouth. You don't want to spray it on the handle too much because this stuff is super slippery. So when you're using the instruments, if you put it all over the place, if you put this all over the place, the instruments are super slippery and it sucks to use. All right, let's review what we've learned so far. You know what an orthodontist is, you know what the different types of wires are, you know the different type of brackets or braces. Remember there's two different types of slot sizes. Within that, there's also different name brands and there's different prescriptions within those brackets. That's why there's like hundreds and probably thousands of different brackets, just because there's so many different manufacturers. But you know that, you know the different sizes of the wire, why some are called just 16 niti, why some are 1622. You know that the sizes, even though they can be the same, the flexibility of the wires can be way different depending on if it's a niti wire or if it's a stainless steel wire. What else do you know? You know the different instruments, you know some of the basic terminology on how to name the teeth. So now that you have that decent knowledge, we're gonna go through the consult form and try to get some terminology down, because I want you guys to know this stuff because it's so much easier to talk to you if you know some of the basic terminology. So I'm actually going to go through this. I'm going to go through the consult form, a form that we use every time basically that we do a consult. We've been using the same form for a long time. It may get modified a little bit, but now at least when we go through it, you're going to know what the different names or the different vocabulary. So I'm just going to go one by one and I'm going to explain each category and what it is. OH, straightforward, that's oral hygiene. That's how good their hygiene is, if they're good brushers, flossers, if they have gingivitis, or if they have bone loss, if they have anything. Obviously that's going to be towards the bad end of things. If they're good, that would be good, obviously. Classification, this is important and most people don't know this yet, which I thought they taught in dental assisting school, but I guess they might not teach it. And this is classification. Okay, so there's difference between class 1, class 2, and class 3. And this is really important because we use this every single day, and this relates to basically everything we do when we're talking about rubber bands, or we're talking about face, or we're talking about any of that stuff. So class 1 is an ideal bite, an ideal occlusion. And I'll probably have some infographics here too. But class 1 is when the canines go in between, so the maxillary canine goes in between the lower canine and the lower premolar. That is a class 1 bite. I have molars and canines here on the consult form because sometimes you can have a class 1 molar but not a class 1 canine. And the left side can be different than the right side. But in general, class 1 is a good bite. Class 2 is when you have a big overbite or big overjet. Overbite and overjet are later on in this this form, so I guess I can just go through it right now. So overbite is when the top teeth overlap too much vertically. Okay, so it's like this, it overlaps too much. That is a big or deep overbite. Everybody has a good bite, has an overbite, but it can be too deep and that's not good, or if it's too little, that's not good either. But that's overbite. Overjet is when the teeth stick out too much. So this is a horizontal thing. Okay, so overbite is when it's too vertical, overjet is when it's too far out. That's the differences. Most people don't know that. Definitely the general population definitely does not know that, but that is the difference between them. So let's go back to class 2. Class 2 is when you have a big overjet. Okay, most of the time when we're talking to patients, because they don't ever hear of overjet, we'll commonly say overbite, but in reality I mean overjet. I just don't want to confuse the patients. So class 2 is when you have a big overjet. Sometimes you'll see their face and their mandible, their lower jaw is going to look really far back. That is class 2. All right, and that will help you later on when we talk about rubber bands, because that all relates. Class 3 is the opposite, basically. That is an underbite. So like this. When the lower teeth are ahead of the bottom teeth, that is an underbite, or that is class 3. So that's the difference between class 1, normal bite, class 2, too much overjet, and class 3, an underbite. Okay. Keep in mind when you're talking about things, your bites can be different, but you can still have different types of overjets and overbite. So when we're talking about overjet, and there's a class 3, so the lower teeth are ahead of the top teeth, you might have a negative 1 or 2 or 3 or 4 millimeter overjet. But your overbite sometimes actually can be not that bad, because we just talked about the vertical overlap. So sometimes for me, I'll say, hey, you know what, they have a negative overjet of say 1 millimeter, but I'll say, hey, potentially the overbite is okay, even though the bite doesn't look very good, because the vertical dimensions are actually pretty decent. So that's for me, that's how I do it. But now you'll know the difference between class 1, 2, and 3, what an overjet is and what an overbite is. Okay, so we've gone through that a little bit. Let's go through the look of the head. So sometimes we'll say it's straight, we'll say it's convex, or it's concave. And what the heck does that mean? Concave, in general, it says concave. That is in general a class 3 looking bite. That's when you look at from the side and it has a bite where the lower teeth seem too far forward. So it's like this, that's concave. Okay, convex is the opposite. That's the opposite, where it will look like the lower teeth are too far back. That is a convex profile. Majority of people, to be honest, have a convex profile where the lower teeth seem too far back, and yeah, less people have a concave profile. Just because there's less class 3s in the world, basically, than there is class 2s. There's a lot of people who have class 2s, and if you start working with me, you'll know that we do class 2 rubber bands on a ton of people, because so many people are class 2. It just happens all the time. Okay, as we keep going down the list, you're going to notice the difference obviously between primary dentition and permanent dentition, or a mixture. And so primary, you already know this, that's all baby teeth. Mixture is you have some baby teeth, you have some adult teeth, and then obviously adult teeth is all adult teeth. And remember, when we talk about teeth numbering, the same thing goes for baby teeth. So remember, we start from the center, the centrals are 1s, laterals are 2s, 3s, 4s, 5s, goes out like that for adult teeth. Baby teeth, it is different. Baby teeth, you still start from the center, but it goes A, B, C, D, E, F, G. So it goes backwards, but you use alphabet letters instead of numbers. So that's the difference between baby teeth and adult teeth in ortho. So remember, baby teeth are primary teeth. Start with A in the middle, B are the laterals, C are the canines, and go back from there. So that's how you know the different types of teeth. All right, as we keep going down the list, you'll notice there's a spot for spacing or crowding. That should be pretty obvious. Crowding, the teeth are crowded, they're curved, there's no space for them. Spacing, exact opposite. Lots of spacing, easy peasy. All right, as we go down the list a little bit more, we talk about overbite, we talk about overjet, which we already talked about. Remember, overbite, vertical, overjet, horizontal, and then there's also something called open bite. And sometimes you'll see this in patients who are sucking their thumbs, fingers, pacifiers, they have some sort of tongue habit, and that's when they bite down, but nothing, their front teeth don't touch. So an overbite is, boom, your front teeth are overlapped too much. An open bite is they don't come together at all. So that is the difference between that. All right, then you have a spot for cross bites. And so this can be in the posterior, in the back, or the anterior, or in the front. And a crossbite is just basically opposite of normal, I guess we can say. So in the front, you know, you want your top teeth to overlap your bottom teeth. If it's the opposite, if the top teeth are on the inside, we call that a crossbite. And the same thing goes for the outs or the backs of the teeth. you want your top teeth to overlap your bottom teeth. If it's the opposite, we call that a crossbite. If the lower teeth are kind of on the outside of the top teeth, that's a crossbite. It can be so far that they don't even bite, or it can actually be the opposite. Sometimes we call it a scissor bite, different names for it, where the top teeth are too far out and they don't bite at all. But in general, most of the time, a crossbite is the top teeth are on the inside of the bottom teeth. And then you have another spot there for midlines. And so most of the time what we're looking at for this is we want everything to line up. We want the nose in the middle here to line up with the middle of the teeth. So sometimes, because you have a lot of people have asymmetries, the top teeth will be too far to the side, too far to this side. The bottom teeth will be something like that too. So I'll say, hey, you know what? The bottom teeth are to the left 3 millimeters. You just write that down, and that just has to do with symmetry. The last couple things are TMJ, which you guys should probably know about. TMJ is the temporomandibular joint. That's the maxilla and the mandible, and there's a little piece of cartilage in between there as well. Hopefully most of the time it's normal, some of the time it's not, and it clicks and cracks, or there's something called crepitus. So clicking is when, and you can go into this more, I might have some videos for that too. Clicking is when you have the mandible, the lower jaw, clicking on and off of this piece of cartilage that's right there. Crepitus, which you rarely hear, but you hear sometimes, is when this disc, this joint that kind of allows the jaw to open and close smoothly, is worn down, is totally basically broken down, and the jaw, the mandible and the maxilla are kind of grinding on each other. So that's crepitus. But most of the time, hopefully it's W and L, or that's within normal limits, or it's just great. So a couple last ones again, the pathological findings, that's just if you have anything unusual. If we see a cyst or we see something hopefully not cancerous or malignant, we will mention it there. We'll talk about the TMJ, which we did. And then lastly is frenum. So frenum is basically all these pieces of tissue that connect from your lip to your teeth or your gingiva. So sometimes if you lift up like that, you'll see people have a big frenum in between the two front teeth. Sometimes that's why their teeth aren't together. You might get that same thing on the bottom, and that's frenum. So sometimes I'll say, hey, you know what? We have frenum involvement on the maxilla or on the top. I know this, mark that right there. And then at the end of it, we're going to talk to you about treatment time. So we typically do treatment time increments all the same. So it's really straightforward, really easy. We say it's anywhere from 6 to 12 months, or 12 to 18 months, or 18 to 24 months, or 24 to 30, or beyond that. But we really try to keep it within those dimensions to make it as easy as possible for everybody, for the patients, for you, for the assistants, for the managers, for the treatment plan coordinators, for everybody. We really try to keep it within those realms. All right, guys and gals, so there you have it. That is the intro. This is part 1. There's going to be the next parts where we talk about when the patient actually comes in, what we do, how we take pictures, how we take panels, cephs, and how we get the patient started. But this is it. So you guys have a good foundation of knowledge. You know a lot now. You know the different materials we use. You know the different instruments we use. You know the basic vocabulary of ortho, which is important. You know how to number teeth, you know what convex, concave profiles are, you know the different classifications, you know class 1, class 2, class 3, you know crowding, you know spacing, you know asymmetries, you know frenum involvement. I know we went through a lot, and you can rewatch this over and over, but I really expect you guys to know this. After the first week or so, if you're working with me, I'm going to be quizzing you like crazy to make sure you get this, and the other trainers are going to be quizzing you like crazy to make sure you know this. So it's really important. Watch this over and over. If you have any questions, remember, ask me or ask one of the trainers or ask somebody who's done this a lot so they can help you out. So know this stuff, and I will see you in video 2.